Welcome to The Hill's Coronavirus Report. I'm Steve Clemons, editor-at-large of The Hill. Each day we're interviewing consequential leaders and innovators in the battle against the coronavirus. COVID-19, like other crafty killer viruses, doesn't just go after people with underlying conditions, exposing human weaknesses and preying on them. It also paralyzes societies and shows the cracks and fissures and deficits in how they're organized. One lesson of this pandemic is that while supply chains that sprawl globally and have a logic to them during good times, when there are no crises, those supply chains can also be weaknesses in times of national security stress. Supply chain management and ongoing awareness now of what America can produce and can't, and where the U.S. has strategic dependencies, are all going to be new realities that we have to monitor. One of the premier companies in the world that specializes not only in complex supply chain logistics, but actually in the PPE gear we have talked so much about, is a company that's actually called Premier. Joining me now to talk about the myths and realities of supply chains and where we need to go as a nation is Michael Alkire, president of Premier. Welcome, Michael. Thanks so much for joining us. Fascinated by your company. I mean, you're right in the middle of the muck, as I say it, on PPE, supply chains. Why don't you give us, if you will, the strategic dashboard as you look at it about where America is strong and where it is weak right now when it has come to this virus and the needs that we have, that we discovered that we needed?
First, let me just say thank you for having me. We appreciate the opportunity to talk about this incredibly important topic. So very quickly, Premier is a global healthcare supply chain. We have been actually contract manufacturing for goods and PPE for almost 10 years, all across Southeast Asia. From a report card standpoint, to answer your question, I think that obviously with the first surge, we were able to, get the appropriate PPE, the masks and the gowns and other capabilities of, probably 4 or 5 weeks into the virus. And we had a lot of troubles up front. And it really sort of exposed the weaknesses of the industry at large. That we really didn't have this resilient supply chain that we obviously needed to ensure that our healthcare providers were safe, to obviously provide care to these pandemic patients. And so where we are from a sort of a progression standpoint, obviously additional networks have been set up. We've created additional logistics. There's been these brokers that have sort of stepped into the middle, who are also obviously getting access to product. But we've got a long way to go. We need to continue to think about how are we creating more resiliency in the supply chain. We've got to have a much more diversified manufacturing base. We've got too much exposure in China. We've got to continue to diversify into other areas in Southeast Asia. Just as importantly, we've got to diversify much more domestically as well as nearshore. So we've got to really be thinking through, what are those strategies that we need to be embarking upon to actually diversify those supply chains. So, for example, we just a few weeks ago made an investment in a domestic manufacturer of N95s and other personal protective attire. So we think that that's going to be sort of a chassis for us to, continue to diversify the supply chain. We're in conversations and having discussions around joint ventures to do more nearshore kinds of investments as well. So I think we're in the early innings, but from a report card standpoint, we're progressing. I've been now talking about PPE. I do worry about the scenario playing out with pharmaceuticals. That's a little bit, in some cases, a bigger lift. So we've got to be very, very thoughtful around the transparency of where not only the finished goods are being produced, but also the raw materials and that active pharmaceutical ingredient. We've got to make sure we understand where all of those products are being produced, and we've got to make sure we've got more resiliency in the supply chain there.
Well, I've talked both to the CEO of Teva, the CEO of Mylan about APIs, I understand active pharmaceutical ingredients, so much of which apparently come from China. And at the same time, I've had U.S. senators on in discussion who didn't realize that America made virtually none of that. And so I'm interested in the pharmaceutical side of it, but I'm also interested broadly. You just talked about working with an American manufacturer. I'd just love to get your insights into what public policy leaders need to understand if they're going to draw production back into the United States, if they're going to begin to seed some of that here. What are the kinds of things they need to do to be competitive and to provide that foundation that makes making it here competitive with making it elsewhere?
Great question. So I think there's 5 steps that we want to really think about, and we want to educate senators and Congress folks around. The first is we need to have continued diversification in terms of where these products are being produced. So it's not good enough, that we're diversifying out of China and into Southeast Asia. We've got to do more diversification into nearshore and domestically. So that's number one. Number two, we've got to have more transparency. So the FDA has done a pretty good job of understanding where the active pharmaceutical ingredients are being produced for the finished good drugs, but we need to know where those other ingredients are being produced. We worry at Premier that we've got a disproportionate majority of other materials that go into those finished goods that are being produced in China. Third, we've got to have an ability to connect from a data standpoint so that we can dynamically allocate products when there is a surge, right? So, everybody right now is racing to create stockpiles, and that's putting an incredible pressure on the supply chain. We've got to manage this more effectively and have the states talk to the federal governments and the federal governments and the states talk to the healthcare systems, because everybody's in this market now trying to buy at the same time, and it's driving price up. And the last area that I think we need to focus on, and it goes right to the heart of your question, is we call it sort of this idea of infrastructure 2.0. So over the years, we've talked about infrastructure 1.0, which is we've got to rebuild the bridges and the roads and make those investments. I think we've got to create that same infrastructure for domestic manufacturing. And if that means we need to have different policies with the EPA or with the FDA in terms of getting approvals and those kinds of things, we need to be much more open to allowing us to be, quite frankly, a bit more entrepreneurial and bringing more businesses back here, and think of it in terms of these are products that our communities absolutely have to have.
One of the things that concerns me about the discussion, I don't know if it concerns you, is that while we talk about global supply chains and multinational firms, we're putting a kind of American nationalistic frame around this. If I had, say, the CEO of 3M, Michael Roman, on here talking about it, he said, the reason we have productive capacity in Germany or in Southeast Asia is that we're also supplying other global markets, and that by supplying those other global markets and doing things there, it also allows us to supply and produce things here. So there's a kind of global logic to some of what's been happening. But as we saw, we kind of entered the law of the jungle when COVID hit, and nations began scrambling to do their own deals, and it kind of ran opposite, if you will, of the global supply chain. What do you think lay people need to hear to understand the strengths and the reason why supply chains are the way they are, and why they won't just work inside one country?
Yeah, so a couple of things. I think that we've had these two phrases. One we say we want generic drugs. And what is a generic drug? The expectation by the public is it's going to be the lowest cost. We also use the term commodity, and and a PPE for the most part is a commodity item. And so what the public needs to understand is when we use those two terms, we are going to create the most efficient mechanism. And I mean, the manufacturers, are going to try to create the most efficient mechanism possible to actually produce those products, which means oftentimes you're going to have very narrow supply chain without the level of resiliency. What I think we need to do is we need to reframe the terms of PPE and some of these generic drugs. They aren't the generics or the commodities, if you will, that have to have these really narrow supply chains that expose us to an issue like a pandemic. But instead, we need to be thinking about the importance of having those products and building some resiliency around those supply chains.
So I think what you're talking about is something else that Premier has been involved with, and I don't understand it that well, but would love you to get it. It's a little bit of an early warning system, and you've got such a broad distribution network, you can sort of measure where supply is needed, where demand is needed, and how you begin moving it. And so maybe it's sort of a just-in-time system plus where you've got kind of antenna out there about what's going on. Can you tell us a little bit about Premier's activities there and how that might improve the ecosystem on health goods provision?
Sure, and I really appreciate the opportunity to answer this. So today we know that there was an article that came out in the Annals of Internal Medicine, I don't know, a couple of weeks ago. There was another one that came out in the New England Journal of Medicine, and it talked about the false negatives that are occurring, meaning that the closer that a COVID patient is to actually acquiring the virus and when they get the test, in the Annals, it actually said there are false negatives of 100%. That means that these patients, they truly have COVID, but they tested negative for it. So we don't think testing is the only way for the various health officials and the governors and others to really measure what's happening from a community aspect as it relates to COVID. We actually think another important attribute is looking at this sort of syndromic surveillance. And we've developed a technology at Premier that actually gets into the electronic medical record, and we look at the symptoms of a patient that presents to a doctor. And so you think of COVID, it's dry cough, it's a fever, it's they lose their sense of taste, and there's like 8 or 9 of them. Anyway, we want to look at those symptoms in real time because there's a pretty high probability that those patients actually have the virus. But we get that data and that information very quickly, and we can get it at a zip code level. And the reason that's so important is that, as states are contemplating the next potential surge of the virus and the importance of opening the economy back up, with all that information, we can now inform health officials, at a zip code level that, you may have another surge, or you may have a higher prevalence of the virus. So the point is, you don't have to shut the whole state. You don't have to shut a whole city. There are certain pockets by zip code where we're starting to see a surge. And that information, I think, is something that these health officials can rely on, really to balance community health needs versus opening the economy.
Michael, just the last question here, and thank you for the very, very fascinating descriptions of these programs. I know you're in the private sector, but you deal with governments, you deal with other players, you deal with nonprofits. There's been a lot of critique, we'll call, of the federal government's role in the PPE game. And I've talked to governors and mayors who are very frustrated about their materials being hijacked by Jared Kushner's committee or something. But if you were to advise the White House on how to get this right the next time, what would be some of the things you'd like to see the federal government do in anticipating either future waves of this virus or anticipating something as systemically impactful as a future pandemic?
Yeah, so I think there's 3 things. One, I would advise them on creating a data infrastructure to allow for us to dynamically allocate critical products. So think of ventilators, think of other PPE. So number one is, let's create some technology that sort of overlays utilization patterns of those various products. Number 2, obviously this idea of, and I'm going to call it efficient stockpiling. There are certain things that I think the federal government needs to stockpile. Ventilators come to mind. And there are certain things probably the states need to stockpile. I think about PPE because it's used for multiple industries. And so, a large part of the communities use that. The final thing I'd tell the administration is, look, we need to create a syndromic surveillance capability to help inform our states and local governments on how to open appropriately, with additional surges and those kinds of things. But I think we've got to do a better job of leveraging the technology that already exists today in the form of syndromic surveillance to really inform those important and critical decisions.
Well, what a great discussion. Well, Michael Alkire of Premier, thank you so much for sharing your insights and experience thus far. And all I can say is keep it up, and we'll look forward to having you back again. I want to thank all of you for joining me today. We're going to see you next week. I'm Steve Clemons. Be well and have a great weekend.